Thank you for viewing this educational program. This module discusses cystoscopy. Cystoscopy is a medical procedure in which a doctor looks into the bladder and urethra or urine channel with a special telescope. The procedure allows the doctor to diagnose or treat certain conditions of these structures. It is usually a simple outpatient procedure done with you awake under local anesthesia or freezing. Rarely, it may require intravenous or IV sedation to keep you drowsy, or even general anesthesia or spinal anesthesia. As mentioned, cystoscopy can be used to either diagnose or treat certain conditions. Situations requiring cystoscopy for diagnosis include blood in the urine, significant urinary symptoms, the inability or difficulty to pass urine or empty the bladder, painful urination, urinary tract infections, and abnormal findings on X-ray, ultrasound, CT scan, or other imaging studies. Conditions that may be treated with the assistance of cystoscopy include bladder conditions, such as tumors or various types of inflammation, and prostate or urethral conditions, such as an enlarged prostate or scar tissue in the urethra. Typically, there is no special preparation required if you are having a simple cystoscopy under local anesthesia, although your doctor's office or clinic may advise you of specific requests. For these procedures done under local anesthesia, it is probably best to eat a light breakfast or lunch prior to the procedure. As with any medical appointment, it is helpful to bring with you a list of your medications, including supplements, and allergies. Please also advise your doctor and the clinic staff if you normally take antibiotics before dental or other procedures, or if you have a known heart murmur, artificial heart valve, or recent placement of any foreign material such as an artificial hip or coronary stent, etc. Unless otherwise instructed, you should take your usual medications on the day of the procedure. The next few slides will explain how the cystoscopy procedure is performed. In men, cystoscopy involves the passage of a small flexible telescope into the bladder with the patient lying down. A rectal examination to feel the prostate may also be performed afterwards as part of the assessment. Cystoscopy is usually a very quick outpatient procedure. After positioning, the skin is cleansed and freezing jelly is passed into the urethra to numb sensation. Most patients should experience minor discomfort only, which is minimized by taking deep, slow breaths and relaxing, especially the pelvic muscles, as much as possible. You may feel anything from a cool sensation or pressure in the urethra to a slight burning sensation with passage of the freezing jelly. Some patients describe it as feeling like they are urinating backwards. You may feel more pressure with passage of the scope and a cool sensation as the bladder is filled, then a sense of fullness or a need to urinate. At the time of cystoscopy, other testing or procedures may be performed, depending on the situation. These may include a rectal examination, a biopsy of the bladder, removal of small stones from the bladder, X-rays such as a retrograde pyelogram, a cystogram or urethrogram, placement or removal of a urinary stent, dilation or stretching of the urethra, or injection of certain agents into the bladder or urethra. Some of the more common procedures are discussed on the next few slides, and others may be covered in other modules. A bladder biopsy involves removal of a tiny piece of bladder lining to examine under a microscope and may be required when the lining looks abnormal. For this, a small instrument is passed through the scope and grasps and removes a small piece of bladder lining. If there is some bleeding, the area may be cauterized with another small instrument. This seals the bleeding blood vessel. During a bladder biopsy, you may feel a pinching sensation, and afterward, you may notice some blood in the urine for a short time. Occasionally, at the time of cystoscopy, a retrograde pyelogram will be required. This is an X-ray test where contrast dye is passed up from the bladder to the kidney through a small tube passed through the cystoscope and up into the ureter. This is an excellent method of examining the entire ureter and drainage system of the kidney. A urinary or ureteric stent is a long, narrow tube extending from the kidney to the bladder, which helps to maintain drainage of the kidney. Stents are usually placed through a cystoscope with X-ray guidance. Sometimes a string is left attached to the stent to make removal of it simpler, but often another cystoscopy may be required to remove it. Following cystoscopy, you may feel the need to urinate right away, and there may be burning with urination, frequent urination, or blood in the urine. This should not last long and usually clears up after urinating a few times. Normally, you may drive home unless you have received sedation or general anesthetic. Once home, you should drink plenty of liquids, and you may resume your normal diet. If you experience discomfort, a warm bath can help ease this by relaxing the pelvic floor muscles. Depending on your situation, your doctor may prescribe medication for you. Otherwise, you should not need to take anything other than a mild pain reliever such as acetaminophen or ibuprofen. Cystoscopy is a commonly performed, low-risk procedure. As mentioned, blood in the urine may be seen afterwards and usually clears quickly and is of no consequence. There is a low risk of infection, likely less than 1%, and this is minimized by drinking plenty of liquids after the procedure. In some situations, depending on your risk and the preference of your doctor, you may be given an antibiotic around the time of the cystoscopy. Some patients may experience difficulty urinating after the procedure, or more frequent, urgent, or painful urination. This can be lessened by focusing on relaxing the pelvic muscles when urinating. Any time that instruments are passed through the urinary tract, there is a small risk of later developing some scar tissue there, which can lead to symptoms of a blocked urinary stream. The risk of this with modern instruments is extremely small. Having said all of this, you should contact your doctor if you experience any of the following after cystoscopy: sudden chills or shaking, a fever of more than 38 degrees Celsius or 100.4 degrees Fahrenheit, cloudy or foul-smelling urine, new severe pain, burning lasting more than 2 days, blood in the urine lasting more than 2 to 3 days, or significant difficulty emptying your bladder. In summary, cystoscopy is a simple and common outpatient procedure used to diagnose and treat conditions of the bladder and urinary tract. It is well tolerated, causes minimal discomfort, and is associated with minimal risk. Thank you again for viewing this educational program.